Okay, folks, let's jump into the anatomy of swallowing. We'll begin our review. So some starting points. Again, I want you to go back to your notes from SLP 320. You should be familiar with most of the terms that I'm going to introduce you to here. I may go into more depth on some of the structures than what you were introduced to in 320. You might have had a very cursory review of some of the structures within the larynx itself, um, because we're going to talk about them slightly differently for swallowing than we talk about them for voice. Okay, and you probably were introduced to this, the laryngeal anatomy in the first 8 weeks of this course. So I'm probably going to have you use a couple additional anatomical terms. Okay, also, as we get underway, I want you to know that generalizations on anatomical features and presentation can be hazardous. You have to be careful about trying to make generalizations. One person's anatomy may look very different than another person's anatomy, and that anatomy may still be very functional in both of those individuals, even if it doesn't look the same between the two. Okay, couple things to be aware of. What you have learned is not always what you're going to get, right? So we would be out of a job if everyone we saw looked like what I'm about to explain to you in normal swallowing. The reason why SLPs work in swallowing is to identify swallowing disorders. So you're going to learn here how things work under normal circumstances, but you're not always going to get that. In fact, in your work, you're more likely not going to get that. You're going to get clients that do not have typical swallowing function. And you should know that what you see is what you get. Okay. So you might learn how it should work, but at the end of the day, what you're seeing in front of you is what you get. So you need to be able to deal with that which is in front of you. There's a very wide distribution of normal when it comes to anatomy. So, and especially when we're referencing functionality for safe swallow. Some people may look like they have anatomical structures that should generate a safe swallow, and their swallowing doesn't look so great. Some other people that look like things are not functioning very well at all, but seem to be safe nonetheless. Okay, so there's a very wide distribution in what you might see. When we're looking at swallowing, we're looking at the system for what it can do and what it cannot do. That's going to inform our recommendations and our plan of care. So that's kind of the overarching thing, is that we're looking at the structures for how they're functioning, and we're trying to push that system to find where we get the best performance and also where we see breakdown, because that's going to help inform our management plan for our clients. Okay, so let's jump into the oral mechanism. This is the only anatomy we're going to cover in this particular chat. You may remember from your, and again, SLP 320, your anatomy and physiology class, that the function of the oral cavity in rank order, its number one function is respiration, okay? Because that is, that just ranks highest in the biological functions of the human being. So we're going to use our oral cavity for breathing. That's first and foremost. That's why the system is patent or open. Okay, so the system's going to be open so that we can breathe. The oral cavity is also going to be used in deglutition or swallowing, moving the food from the oral cavity down into the stomach. And then finally, we're going to co-opt this oral cavity to engage in communication, in particular in speaking or speech production. You should be familiar with all of these structures by now from your anatomy and physiology class. So we have the lips, we can see we have the upper lip, and then we have the lower lip. Okay, and these terms might be newer for you, so I do want you to know them. We have something known as the anterior sulcus. We have one down here. That's the space between the lower lip and the gum line, right? Or the jawbone. So this down here is the anterior sulcus right here, this space right here. And this would be the upper, right, the upper anterior sulcus, that's space. So you can see these forceps are pulling the lips away so that you can see the anterior sulcus. They're both anterior. This one's just on the top, on the maxilla. This one is on the bottom, on the mandible. The lateral sulcus is on the side. You'll remember the word lateral means on the side. And this does not, they're not pulling open with the forceps the side to see, but the lateral sulcus would be over here. Now, why am I introducing you to this? Just think about if you were eating a dry cookie or other things that sometimes get stuck in your sulci. Okay, so that's an area where we might accidentally pocket some food. Okay, so we've got our lips and we've got our anterior and lateral sulci, and then our cheeks. You can't see them here, but of course, you know where your cheeks are. And if you will, your cheeks are the outer part, and your mandible, your maxilla and your mandible are the inner part that form the boundary for this lateral sulci, right? So your cheeks are on the outside, and then your teeth or your gum line is on the inside. And when we talk about the tongue, we're going to talk about the tip of the tongue. Right here is the tip. Okay. We're going to talk about the blade of the tongue, which is in this part over here. That's the blade of the tongue. And then in this view, you can't see it. At the very back is what is known as the base of tongue. So way at the back, rooted in the back of the mouth. And I'm going to show you other pictures so you can see it. That's the base of tongue. Okay, and we know our teeth. So we've got our upper teeth up here, right? And we've got our lower teeth down here in our mandible. Okay, and then you know your mandible, that's the mobile articulator, right? So your mandible is your lower jaw. This is the mandible, the one at the bottom. We have our hard palate at the roof of our mouth, and that is the one contained by the maxillary and palatine bones, right? So this one's the hard palate, and it's called hard palate because it's bones, right? So it's the maxilla fused with the palatine bones. And then we have our soft palate, also known as our velum, and that's at the back of the oral cavity. Okay, so our soft palate is muscular and mucosal. So after the palatine bones, we have our soft palate, also known as our velum. And hanging, dangling off the back of the soft palate is a structure known as the uvula. Okay, the uvula. Now, a couple terms that you may not have been introduced to in your anatomy and physiology class, I'm not sure, but let's talk about them here, are something known as the fascial arches or the fascial pillars. So coming off the uvula is the anterior fascial arch, and then the posterior fascial arch. So it's like the McDonald's arches in the back of your mouth. So anterior is in the front, posterior is in the back. And you can see these things in italics because they themselves do not have a function, but they're landmarks. Okay, and we're definitely going to talk about the fascial arches as landmarks. So here's our palatine tonsils. They're in the palatal region, right between, if they do exist and you can see them, they're between the anterior and posterior fascial arches. Now I'm going to erase again because I want to make sure that you can see all of this anatomy, right? We've got our coming off the uvula, and then coming off the back of the soft palate in the rear is the posterior fascial arches. I want you to listen carefully to what I'm saying. Fascial, it's not facial, it's fascial with an AU, fascial arches or fascial pillars. Depending on who you talk to, you'll hear them termed differently. Okay, some people will call them arches, some people will call them pillars. Here they are listed out again for you, so just have a look through these slides and review for yourself. Okay, Let's look at the side view, just so you're aware of the anatomy again. You can now see the tip of the tongue. You can see the blade of the tongue. That's the main body. So the body of the tongue is known as the blade, and the base, which is rooted into the floor of the mouth. Okay, so we're going to see that rooted well into the floor of the mouth. We can see the jawbone or the mandible on the bottom and the hard palate made up of the maxillary bone and the palatine bone. And then as the bone ends, we're going to get into the soft palate or the velum. And at the very end, we've got the uvula over here. Okay, we can see here, this would be the anterior sulcus on the bottom and the anterior sulcus on the top, right? That's that space between the lips and the teeth or the mandible. And you cannot in this view see the falcial arches, but you know that they would come off like in this direction off of the soft palate. Okay, so they would be like in that kind of direction coming down. And then if we had tonsils, they would be located in these locations. Okay, let's just have a look and stop and review. Okay, moving on. The lips. Some things to know about the lower lip. It has greater velocity and force than the upper lip. That shouldn't be surprising to you because the lower lip is attached to the mandible, and the mandible is the mobile articulator. So because the mandible is the one moving, the lower lip is going to have a greater force and velocity because it's moving along with the jaw. So it's going to do most of the work in closing the lips. So when we want to form a tight seal with our lips in order to hold material inside of our oral cavity, our lips are going to do that job. Okay, so the lips' main role is in holding material inside of the oral cavity while we're preparing it. I would encourage you to stop and take a sip of liquid and see what you're doing with your lips as you go along. The tongue. The tongue is the most versatile and agile, active oral structure. It's going to be the big one in preparing the bolus. Okay, so it's very, very difficult to do much in oral preparation without our tongue. It's highly sensitive to position and force, and particularly force that's placed upon it by other structures. It's a very, very agile structure, and its most significant role is in controlling boluses, so like controlling thin liquids when they get in our mouth, but also helping us prepare and to deliver or propel, if you remember propulsion, a mechanical breakdown and propulsion of the bolus out of the oral cavity. So that's its main function. The teeth, mandible, and the ramus of the mandible, I'm going to introduce you to that because it's a landmark when we're looking at x-rays. So the teeth are going to serve to grind and mash the food into a bolus, right? And one thing I want to tell you folks is that a large number of our clients are going to be elderly. And as we age, our like all elements of our health, our teeth health diminishes. And some elderly folks may not have teeth at all, right? So they may have had all of their teeth extracted. And some of them don't even have dentures. Remember that our teeth, let's look at the top picture, our teeth are situated inside of bone, right? So our lower teeth are situated inside of the mandible, which is a bone, and our upper teeth are situated inside of the maxillary bone, which is a bone. And so while teeth serve to grind and mash food into a bolus, there are many people who are edentulous, that means without teeth. There are many people who are edentulous that use their mandible and their maxillary bones to chew and grind material. It's bone, just like teeth are bone. So I just want to highlight that for you, and that, in normal circumstances, the vast majority, well over 90% of individuals are chewing with their teeth. But don't underestimate the power of the jaw bones in order to grind and mash food. The mandible has four main muscles that serve it and bring the upper and lower teeth in proximity for chewing and mastication. Okay, so there are going to be muscles attached to the mandible that elevate it and lower it in order for us to do the function of chewing. The mandible also serves as an attachment point for one of the muscles of the pharynx. So you can see that back here, and I'm going to come back to this in a later chat. This is the mandible right here, and you can see it right here. It's the mandibular ramus. So you can see it over here. And that mandibular ramus is attached to a muscle known as the superior pharyngeal constrictor. And I'm going to come back and talk to you about that muscle. Here it is right here, this big plane of a muscle. It serves as the attachment point. The mandible serves as the attachment point for this muscle that makes up the back wall of the pharynx. So when we look in the back of the oral cavity, right back here is the pharyngeal constrictors. Okay, so when we look back there, we're looking at the superior pharyngeal constrictor. The other thing that I want you to be aware of is this angle, this ramus right here. It's going to serve as a point of viewing for our swallowing. So I want you to be familiar with that. If you even just coarse up your like use your fingers to line your own mandibular ramus, you can feel the ramus on the side of your face. Okay, moving along. The hard palate. Again, the hard palate makes up a part of the roof of the mouth. So it makes up 2/3 of the roof of the mouth, and it is an immobile structure, right? So it's attached to your skull and it doesn't move. Your mandible is the one that's going to move. And so what we see is the anterior portion. Oops, sorry, I didn't have my pen on. The anterior portion of the mandible is the maxillary bone or the maxilla. And then the posterior portion of the hard palate is the palatine bones. Okay, so it's comprised of the maxilla and the palatine bones, and it separates our nasal and our oral cavities. So if we go back, for example, to this picture right here, we can see that our hard palate, made up of the maxilla and the palatine bones, separates our oral cavity from our nasal cavity. Okay, so our hard palate is going to separate those two cavities. Okay, again, we have our hard palate like here, and then we have our soft palate coming down. Oh, sorry, I'm sorry. Please forgive me. I'm giving you a wrong direction here. We have our, oh gosh. Sorry, folks. We have our hard palate, our maxilla, our palatine bone, and then our soft palate here, and then our uvula here. Okay, so that's kind of what that's going to look like. All right, so our soft palate, that's the muscular extension of the hard palate. And its most significant role is in holding the bolus inside of the oral cavity. So you can see that the uvula dips like this. It's going to connect with the base of tongue, which we're going to talk about. The base of tongue is going to come up to connect in order to keep the material inside the oral cavity while we're preparing it. So we don't want anything falling out. It's also going to have a role in lifting and sealing off the nasal cavity so that we don't get food up into our nose. Okay, so it's got two main roles. One is that it's going to hold material in the oral cavity as we're preparing the food, but then it's going to lift and close off the nasal port so that we do not get material into the nasal cavity while we're swallowing. Okay, so I'm going to have you take some time and just label what you see in these pictures. We'll come back and talk about it in live chat. And again, label what you see, just what we've talked about so far, okay? If you want to do this with a study partner, or if you want to do this with someone in your home environment, I encourage you to get a little pen light, look inside their mouth, and see what you're able to catch. And that's where we're going to end.